I am a certified personal trainer, group fitness instructor. I'm also certified in mind-body wellness and 200-hour certification in yoga. So pretty well-rounded. I've been doing this for about 7 years. And today's workshop is all on low back and hip pain. Has anybody ever experienced that, low back and hip pain? Maybe once?
Yeah. Last week.
Last week? So it's actually the second most common reason that someone would go to the doctor. In fact, second only to upper respiratory infection. There was a recent study that said that 8 in 10 people, or 80% of people, at some time in their life will go to see their doctor about low back or hip pain. It's a $50 billion a year business. $50 billion. So here's a little scenario. So you're working in the office, and all of a sudden you drop your pen on the floor. You reach over to pick it up, and bam, low back pain. It didn't happen right then when you dropped the pen and picked it up. It was probably something that was building up to that. It's not like you were squatting your body weight or trying to, climb over a mountain, but there you are in a world of pain and wishing that you had just left that pen on the floor. So today's workshop is all going to be about not only how you can prevent getting to that situation, but if you've already been there, how you can bring yourself back. So before you undertake any kind of self-care, of course, make sure that whatever low back pain you have is not from a serious injury. If you've been in a car accident, if you have sharp pain when you cough or sneeze, if any of this pain is accompanied by loss of feeling, changes in bladder or bowel movements, then you need to go see your doctor first. Many of the possible causes of low back pain or contributing factors could simply be carrying something one-sided. If you have little ones and you've always got somebody on your hip, carrying groceries, always carrying them in one hand because you've got something else in the other. If you're carrying stuff around the office or pushing things. If, as some of us, we work really hard during the week, so we get our weekends filled with all of our physical activity, right? Don't do anything Monday through Friday, but Saturday and Sunday, you might be there at the gym every single day. Weekend warriors. Not good for your body. You might think that it is. Stress can also be a huge contributing factor to low back pain, as well as leading an inactive lifestyle, perhaps being overweight. These are just a few of the possible causes. Any low back pain that you may have that lasts more than 2 weeks actually can start this series, okay? So you have low back pain, so you're inactive. You're inactive for more than 2 weeks. The muscles start to atrophy, less blood flow. The inactive muscles leads to more back pain, and before you know it, it's this ongoing thing, and now you have chronic low back pain. Some of the things that you can do just simply to prevent low back pain, watch your posture. Oftentimes, especially those of us that sit at a desk all day, we're like this all the time, right? You're sitting, you're slouched, everything is all forward movement, and you're sitting, and you're sitting for a long period of time. It might be 8 hours, and you get up maybe once or twice just to go to the restroom. You can exercise regularly, just getting up on a regular basis from your chair once an hour. It used to be okay in an office once an hour, but go out and have a smoke break, right? And that's completely okay. But how often do you get up just to take a break for your body, just to walk or to stretch? We're going to work on that toward the end of the workshop, and I'm going to show you some great things that you can do in less than a minute at your desk. You never even have to leave. You could even do it while you're on a conference call. They actually, WebMD, you guys have ever been out to WebMD online? They did a recent study that showed that a 12-week yoga program drastically reduced low back pain in individuals that had it. And not only during that particular 12-week study, but the reduction in low back pain lasted for months after. So just getting in and regularly doing that. Okay, so you guys ready for a little anatomy now? Some of the muscles that are directly contributing to low back pain are the Erector Spinae muscles. It's actually a group of 3 muscles that run up and down the spine, attaching from the very lowest point of your lumbar spine and the sacrum all the way up to the base of the skull. Then there's the multifidus another small group of muscles, and we'll go through all of these in a little more detail. The psoas muscle, the hamstrings, and the abdominals. So let's start at the very beginning. The Erector Spinae. As everybody said, they run parallel to the vertebral column, and you can see in that nice little handout that you have, they are just like long fingers that run up the spine. The three different muscles, you've got the spinalis, which are the ones that are the very closest to the spine, and they connect from one spinous process to the next. The spinous process is that little kind of bony protrusion that comes out of the vertebrae, and you can feel those if you run your fingers along the back. The longissimus, the longest in the Erector Spinae muscles, is next to that, so it's going more out toward the shoulder, and they run from the ilium, which is part of the pelvic bone in the back, up to the vertebral transverse processes, and then up to the next and the next and the next, kind of like a little ladder going up. And then finally you have the intercostalis, which is most lateral, that's toward the very outside of the back, and they basically run from one rib to the next. So why or how, you may be wondering, how do these contribute to low back pain? So these muscles actually become weakened by habitual sitting. You're sitting all the time. You may be sitting improperly, improper posture, so you're not using the muscles to hold yourself up. When you're not using them, just like any other muscle in your body, it becomes weakened. And actually, one thing that I thought was really interesting was not only disuse of the muscles, but sitting habitually using a low back support. I know that this may contradict the ergonomics of the office, that you want to have that low back support, but it actually can contribute to low back pain because not only is it supporting your spine, which is great, but it also means you're not using your muscles to support your spine. So don't tell the ergo guy that I said that. There's actually a significant correlation between weak Erector Spinae muscles and low back pain, and they've actually done a lot of studies on this. When the Erector Spinae are not working properly and they're not strengthened enough to hold up your spine in a good posture, other muscles that aren't made to hold up your body are working harder to take over what they're supposed to do. These muscles can be specifically injured from chronic spinal flexion. This is flexion, sitting forward. You're chronically sitting forward, so your spine's not working to hold you up. Lifting, twisting, falling, again, carrying something heavy on one side. Next muscle, the multifidus. Multifidus, you can think of the multifidus as muscles that weave their way up the back. They're right next to the spine. They're a great support of the vertebral column. So kind of like basket weaving, the muscles kind of weave. Some cross just one vertebrae to the next, some cross more than one at a time. They actually, their job, their main function is to take pressure off the vertebral discs. They co-contract, means they work together with the transverse abdominis of the core. We're going to get into that later. But they work specifically in the lumbar, the lower back area, to help support the spine. This is one of those muscles. If the Erector Spinae, the big muscle in the back, is not doing their job, these little teeny tiny multifidus are having to hold the load of the rest of the muscles. So can you imagine, big muscle compared to little muscle, it's a direct contributor to low back pain. Next muscle. We're moving down to the Quadratus Lumborum. This is actually kind of a fun little muscle. It's a square-shaped muscle, and it attaches from the lower lumbar spine to the back of the pelvis. In animals, this is the tenderloin. So this is your tenderloin. It draws the rib cage down during a forced exhalation. So, for instance, coughing. If you put your hands on your ribs and just do a fake little cough, you can feel the lower ribs kind of pulling down. That's the Quadratus Lumborum doing the work. They pick up the slack when the Erector Spinae, again, those big muscles along the back, are not doing their job. Then the Quadratus Lumborum has to kick in. When you contract just one Quadratus Lumborum, it's going to laterally flex the spine. One of the ways that you use this muscle a lot, I know we don't do it a lot here, but shoveling. Okay, maybe not shoveling snow, but shoveling dirt. You know, our dirt's really hard here. Shoveling, yard work. Can you guys think of anything else where it's that kind of a movement where you're really digging, twisting, and turning all at the same time? Bowling, if you've got a ball that's too heavy. Could be. So this particular muscle is actually injured from a combination, as you can imagine, of bending, lifting, and twisting all at the same time. So is everybody from here? Is anybody from somewhere snowy? No? All right, well, I'm from Wisconsin, and growing up, it snowed, you shoveled, okay? And oftentimes, you know, go out and you're shoveling, and you're bending and twisting and laterally flexing all at the same time. And don't you know it, you come out and you're like, oh, my aching back. Well, it's that Quadratus Lumborum screaming at you. Next muscle, the psoas. The psoas is actually on the same picture. The psoas muscle, it's actually a combination of two different muscles. It's the psoas major and the iliacus. Some of us have a psoas minor, but evolutionarily wise, it's not something that's used very often. So most people have grown out of having one of those. So the psoas is basically what we're going to talk about. It's one of the largest and thickest muscles in the whole body. It attaches from the lumbar vertebrae, lumbar is the lower back, to the head of the femur. The femur is the big thigh bone, so it's going to attach right there. So it's actually a primary hip flexor. So what do you think is not being worked when you're sitting down all day? The psoas. Every time you take a step, the psoas is working to bring that leg closer to your torso. Every time you climb a stair. When the psoas, or any muscle for that instance, but particularly the psoas, when it's constantly in that shortened position when you're sitting down, the muscle begins to think that that's normal. And when it thinks that that's normal, when you stand up to come into a normal position, you kind of end up with this kind of thing. Then you're chronically even more tilted forward. So everything contributes to one more thing. In addition, the psoas muscle, when it is not working or functioning properly, normally it works in combination with the glutes, with your butt. If this isn't working properly, neither is this. That's the other side of the hip and the low back. So one of those stabilizing things, one thing, what's that song? The leg bone's connected to the hip bone. Well, your muscles are all the same. If one's not working, the next one's going to have to take over. The psoas muscle brings the low back forward. So if it's in a tightened position, it brings the low back forward because of where it connects on the lumbar spine. It brings it forward and then can compress the joints and discs of the lumbar spine. It actually, because of where it's placed in the hips, can refer pain to the groin, the hip, and the thigh. So you may think that you have hip pain when in fact it could very well just be that tightened psoas that's referring pain elsewhere. Quite a fun little muscle. And speaking on the psoas, there's some actual postural changes that you could make to correct some of the tightening of the psoas. When you're sitting in your desk, oftentimes we kind of scoot ourselves forward a little bit on the chair, right? How many of you sit all the way back on your chair? We don't. Sit all the way back on your chair. It'll actually stop you from leaning forward and the psoas won't become quite so shortened. Stop hooking your feet under your chair. As I look around, now you guys are all putting your feet down. You take your feet underneath your chair. It puts the psoas into a deeper flexion, makes it even tighter and shorter, and thus more activated over time. For those weekend warriors, so we work all day and we go to the gym on the weekend, right? When you're at the gym using the big machines and all, how many of you use the machines that have you sit down? You know, like sitting down and doing your shoulder presses and all that kind of stuff. They're very common. Yeah, what do you think happens when you're sitting down on the machine exercising? Shortening the psoas. So instead, do exercises that force you to stand up. If you want to do an overhead press, instead of doing the one where you're seated in the machine, take a free weight and do an overhead press. Start lengthening those things out. So don't use the seated machines. How about sleeping? Any stomach sleepers in here? I'm not surprised. However, sleeping on your stomach, your back goes into hyperextension, which is exactly the same thing that tightened psoas does. So you're just exacerbating the situation when you sleep on your stomach. So it's actually causing the pelvis to do an anterior tilt. So if you think about your pelvis as a bucket, anterior tilt means it's coming forward like you're splashing water out the front. If you guys stand up for me. You guys look like you've been sitting for too long. Just stand up for a second. Take your hands to your hips and do this little tilt. So you're kind of lifting the tailbone. Doesn't that feel great on your low back? Oh. And now do a posterior tilt. And you can feel it kind of flatten out. So when you sleep on your stomach, if you're already tight here and you move into a deeper anterior tilt, this is what you're doing to your back all night long. Stop it. Stop it. And simply just getting up and moving during the day. Get up, you're on a conference call, stand up and take the conference call. As long as you don't have to be typing. I know there's kind of a big push in a couple of departments to have standing desks. Great idea. I don't know if it's feasible, but even if it's not, you could just stand up. Nobody's forcing you to sit down all day, right? Just keep moving, change your position. All right, another muscle that is directly contributing to low back pain. We might not necessarily think about this one, but the hamstrings. It's actually the muscles in the back of the upper thigh. These muscles attach from your sit bones. You guys know what your sit bones are? Just below the buttocks. It's actually the base of the pelvis. It's the bony little part that when you sit down, it's that bone. It attaches from there all the way down to the lower leg. So it actually crosses two joints. So if you have tight hamstrings, you're getting tightness in more than one area. When the hamstrings are tight, okay, think back, when front of the hip, right, we're tight, it pulls the pelvis forward. If you're also tight in the back of the leg, it pulls the back of the pelvis down. So you get that flattened spot. So imagine if you have all of these problems. You have a tight psoas pulling you this way. You have tight hamstrings pulling you this way. You sit at the desk all day. You've got weakened erector spinae muscles, so your little tiny multifidus that weave through the back, and the Quadratus Lumborum are doing all the work. You are a mess. Come and do yoga once in a while. So what they do when those hamstrings are tight, they pull the back of the pelvis down, causing that low back to flatten. Now, in addition, with regard to holding the body upright, the hamstrings hold the pelvis in a proper position against gravity. If they're tightened and they're pulling this down, that pulling down is putting even more pressure on the bones of the spine and the surrounding muscles, causing them to, guess what? Work harder and doing jobs that they're not supposed to be. They've actually done studies, and they say that tightened hamstrings cause low back pain. Low back pain directly contributes to tightened hamstrings. Vicious cycle, around and around and around. So now we're going to talk about the abdominals. The last little anatomy picture that's in there, my kid's favorite because it's got the 4 layers. My 8-year-old thinks it's fantastic because he's got all these muscles. He's like, wow, Mom, I didn't know. So looking at the picture, you've got the 4 muscles. You've got the rectus abdominis. Okay, everybody wants that 6-pack, right, or 8-pack, or they want to take the ice off of it, whatever it happens to be. Then you have the external obliques, which run this way, the internal obliques, which run the other way, and then the transverse abdominis. The most important muscle when it comes to low back pain and stabilizing the spine. You can think of the transverse abdominis as your internal girdle. And that's exactly what it does. It's a wraparound muscle that supports the low back, actually works in tandem with the multifidus, remember those little weavy things up the back, to stabilize the spine. And they actually play a significant role in reducing low back pain. And we're gonna learn how to do that. So what I want you guys to do is, we're gonna do a couple of little exercises seated here. So the first one that I want you to do is, I want you to just sit in your chair. Just sit comfortably. And I want you to take your hands and find those hip points. So the bony little parts of the hip. And now just move your thighs out and in. Just roll them. And notice what you feel on those hip points. You feel them moving a little bit? When the knees go out, the hip points go out. When the knees come in, the hip points come in. Anything that's going on with the feet and the legs is directly transferred up to the hip, okay? Which is why don't do this, don't do all those crazy things with the feet when you're sitting. So we're gonna do a couple of exercises to help you identify with the transverse abdominis and how you can contract it just sitting in your chair. So take your hands to the seat of the chair. All I want you to do is pretend as though you're lifting your legs, but don't really lift them. So come up with all those actions that you have to come up with to pretend like you're lifting the legs. Do you feel a little firming in the low belly? That's your transverse abdominis, your internal girdle. It's supporting the low back. Now, take your hands to those hip points and do that again. Now you can actually feel it. You can notice that it's engaging. Yeah? Everybody feel it? Amazing, right? Okay. So now what I want you to do, take the hands just to the outside of the chair or to the back of the chair, just somewhere you can give yourself just a little tiny bit of lift. Same kind of action. Push firmly down into the chair. Allow your buttocks to become just light. We're not lifting all the way up. It's not a Superman move. Just lift and feel the firming in the low belly. Now, imagine that your tailbone and your sit bones got really heavy. Allow them to sink, like they're sinking into mud. You ever go walking in the mud after it rained here and you get a boot stuck or a shoe stuck or a sandal stuck? See if you can replicate that same feeling. So the hips are light, the tailbone is heavy, and see if you can kind of get that suction feeling like lifting from the pelvic floor. That's how you engage the transverse abdominis. Now, without losing that, see if you can return all the weight down onto your chair. And see if you can keep that engagement of the low belly. You guys could do this. You could do this workout and nobody would even know you're doing it at the office, right? So that's how you engage that. Now we're actually going to learn a breathing technique that is being used in a lot of rehab situations to help chronic low back pain. It's called diaphragmatic breathing. We actually do a variation of this in our yoga classes. I want everybody to just take a big breath, biggest breath you can. And exhale. Now take your hand on your belly and your hand on your heart and take a deep breath. Keep breathing this way and tell me what you notice. Is your low belly pushing out against your hand, or is your low belly drawing back toward the spine when you take that big inhale? Back? Is anybody's being pushed out when they take that big breath in? Yeah. Well, that's because you come and do yoga with me. You know how to breathe. It's actually incorrect breathing. The diaphragm is a muscle that sits in the middle of you. You've all heard of it. Does anybody know what it does? It helps you in breathing. You answer and I just take it you're answering for everybody. So the diaphragm, when you take a big inhaling breath, the diaphragm actually contracts down, pushing the abdominal organs out of the way. It's making room for the expansion of the lungs. When you take a big breath in and the abdominals draw back, the diaphragm can't push down. So the abdominals are pushing up, And the diaphragm is trying to push down. They're working against each other, so neither is functioning properly in a breath. The result is a chronic shortened breathing, shallow breathing. Terrible, terrible, because it means that you're only breathing out of this very top part up here. When you're only breathing up here, all of this stuff is chronically tight, not being used properly. So using that same idea of engaging the transverse abdominis, I want you to take your hands to your ribs, just to those low ribs, to the low part, okay? Now, engage the transverse abdominis. So see if you can find that narrowing of the hip points, just a gentle firming of the low belly, okay? Not super tight. Now take a deep breath in and feel the ribs expand laterally. And now exhale. Try to keep the transverse abdominis engaged. So the transverse abdominis right now is working to support the low back, working in tandem with the multifidus to support the lumbar spine, and you're able to now take a really big deep breath in. Different, huh? Good. That was our first exercise. Feel better? All right. So first exercise or stretch that we're going to do, so we're going to get into our fit minutes. These are the 1-minute exercises or stretches that you can do at your desk. Don't need any special equipment. In fact, we're just going to be using our chair. So I want you guys to just back your chairs up from your table just a bit, just to make a little bit of room. The first exercise that we're going to do is actually something that I kind of borrowed from yoga. It's a pigeon, and we're going to do it seated. This is both for the external and internal rotators of the hip. We're actually going to sit up nice and tall, making sure feet are underneath the ankles. And you're going to take the right ankle and place it up on top of the left knee so that the ankle bone itself crosses over. Okay, so we don't want to have a dropping ankle. So I want you to flex the foot, drawing the toes toward the knee. When the knee is bent at 90 degrees, by drawing or flexing the toes toward the knee, it actually protects that knee for you. So then just sitting up nice and tall. This is stretching that outer hip. This is the external rotator of the hip. And you could just sit and hold this for 30 seconds. Nobody would even know you're getting a nice stretch. To stretch and change this to the internal rotators, hands to the outside of that knee, keeping everything the same, spine nice and long. Start drawing that knee up towards your chest. Not the chest toward the knee comes up, and you're going to feel that stretch in a little bit different place. Good. Yep. They all attach. They all attach. This is actually a great stretch for, it's not a muscle we covered, but for the piriformis, which is often responsible for sciatica. And then just go ahead and release that down. And uncross the foot. So both feet underneath the knees. And just notice the difference that you might feel side to side. Maybe a little extra blood flow. Okay, let's try the other side. Ankle crosses over, sitting up nice and tall. Shoulders back, spine long. Now, for some of us, we are very flexible, and maybe this isn't enough stretch right here. As long as the spine is long and you're continuing to sit tall, you can start to draw the heart forward. And that'll deepen the stretch for you. So be careful if you're doing this, though, that you're not rounding the back. You get into that same thing of, overstretching all of those muscles. So spine stays long, as if you're just drawing the heart forward. And then back up nice and tall. Hands to the outside of the knee, and just draw that knee up. You can do all the rest of them. Good. Breathe in and out through the nose. So a bonus would be practice your diaphragmatic breathing while you're doing these stretches. And then release. All right, so the next stretch that we're going to do is just a simple seated twist. Sitting up toward the front of the chair. Now, do your office chairs have arms on them? So sitting forward, you could, if you were like in a conference room or something and you had a chair that didn't have the arms, you could turn to the side and use the back of the chair for support. But for today's purposes, again, just like we were before, knees and ankles stacked up, sitting up nice and tall, taking your right hand to the outside of the left thigh, left hand directly behind you or on that chair seat. Lengthen. And as you exhale, turning from your back body to the left. So try not to overpower by taking the shoulder back and keep the chin just in line with the breastbone. We often have a tendency, just because we live here and, in this technology world, everything's got to be first. We lead everything with our head, right? Head in our hands, so we do the same thing when we twist. We think, oh, jam it back, I can turn behind. Allow that twist to come from your center and from your core. And then inhale, come back to center. And let's go the other side. Left hand to the outside of the right thigh, right hand behind. Inhale, tall, lengthen first, and then turning from the back body. And breathe. Good, and to release, inhale, and come back to center. So we're next going to get into that psoas, that hip flexor. There's two different ways that you could do this stretch. It's going to be easy on these chairs. With a chair that has the arms, you just kind of turn sideways and take, say, the left leg back behind you, keeping the hips squared off, and you're just pushing that hip forward. So if you guys want to just turn in your chair, and just take one leg behind. Yeah, it doesn't matter what direction you're going. That hip of the leg that's behind is gently pushing forward, and you're going to immediately feel a stretch. Depending on how tight you are, you may feel it in the quadricep first, and then the hip flexor. Yeah, so this is one way to do this stretch. So let's just turn the other side. So just turn and move to the other direction. So the leg goes behind, the knee is dropping down, and the hip is pushing just slightly forward. Make sure you're staying nice and tall. And breathing. And then release to come back to center. So we can actually do this one, as you could imagine, standing up as well. So everybody come up to a standing position. Starting with feet underneath the hips. Take the left leg and step it back. Doesn't have to go back far, just a foot or two, and you can always adjust that depending on how tight you are this day. And then bend the back knee, dropping it down, and then the hip just gently pushes forward. Again, depending on how tight you are, you may feel it in different places using this variation than you do seated. Does anybody need a little bit more stretch? If you do, maybe not today, you can extend the same arm as the leg that's back behind you, and then just a tiny lateral flexion to the side, the opposite side, and that deepens that stretch. And then inhale, come back up, and step forward. Now let's do the other side, just to make sure we're all even. So stepping back, up nice and tall, bending the back knee, bending the front knee, and that back hip just gently pushes forward. And again, if you'd like that stretch to go a little deeper, extend the arm up, and just a little lateral flexion to the other side. And then inhale back up, and step forward. Good, shake the legs out a little bit. Feeling great so far, right? Low back pain is completely gone, right? So we're gonna stretch now that Quadratus Lumborum, as well as other muscles in the low back. I want you to just take a big inhaling breath, reach the arms out and up. Interlace the fingers except for the index fingers. For most of us, it's okay to have the arms slightly in front of the shoulders. Sometimes we try to jam the arms all the way back, and you might feel that in the shoulder. So it's okay to have them slightly forward. Just keep extending and lengthening. Take a big inhaling breath. And as you exhale, just a little lateral bend to the left. Good. Now, as you're here, breathe, and you're going to feel the right side ribs just expand. Good. With your next exhaling breath, I want you to take the right shoulder and right hip and just bow them forward just a tiny bit. And you'll feel that stretch moving through the rest of the back. You're going to feel this under the shoulders, the shoulder blades, and then inhale all the way back up tall. So the chest comes facing forward again. And now laterally flex to the right. Pause here, take a couple of breaths, feeling the expansion of the lungs, the ribs. And then with your next exhale, the left shoulder and left hip just slightly bow forward. And inhale all the way back up nice and tall. And lower the arms back down. Isn't that great? All right, so one of the other big problem areas, hamstrings, back of the legs. Really, really easy to stretch just standing. Starting feet hip distance, take your left leg and just step it out in front of you. And now you're just going to kind of, just like you're sitting back into a chair, just sit the hips back, and you can take the hands and stack them on top of the bent knee, not on top of the one that's straightened out in front of you. So if you've got your left leg forward, yeah, you're going to have the hands to the right thigh. If you know that you're tight in your hamstrings, it's perfectly fine to have a soft bend in the knee. In fact, it's always better to have a soft bend in the knee rather than jamming the leg straight. Then you could possibly injure some of those ligaments back there. Good, just keep breathing. And then inhale back up, step forward, and then the other side. Right leg comes forward, hands go to the left thigh, spine is long, right? Breathe. Yeah, that's the best way. Just experiment. So just here, point your toe, kind of releases the stretch. Yeah. And then inhale back up nice and tall. So we can do one more stretch that's great for the hamstrings as well as the whole of the backside body. We're going to use our chair. You could also use your desk. This is actually, as all of these are, a variation of a yoga pose. This is downward facing dog. So starting as if this was the base of your chair, or the top of your desk, I mean. So with just hands on the back of the chair, step your feet back. Inhale, spine is nice and long, right? And exhale, just sitting back, allowing the head to drop in between the upper arms. And then you'll decide, if you're not feeling a good stretch here, walk the legs back a little bit farther. It's okay to have the heels off the ground just slightly, but do try to keep the legs mostly straight, soft bend in the knees, but the back really long. So think length, as if you're drawing the heart slightly forward. Good, and to come up, look just forward slightly and inhale, come up and walk your feet forward. If that wasn't enough, use the lower part of your chair. So hands go to the seat of the chair, walk the feet back. Inhale, everything is nice and long, and exhale, just drop the heart and the chest forward, keeping everything long. So think of extending and lengthening the tailbone one direction and the crown of the head the other. Soft bend in the knees. And then inhale, look forward to the seat of the chair and just walk the feet forward and all the way up to standing. Beautiful job. That's all I have for you guys. Exercise-wise, those are your fit minutes. 30 seconds. If it's one-sided, you do 30 seconds on each side. Down dog, you could hold for 30 seconds up to a minute. Well, thank you all for coming.